Well, the World Health Organization has warned against trying to predict when the virus would disappear. In fact, it says the virus may never go away, so we've got to live with it. I want to paint the picture with you in Ghana in terms of the case that we've recorded. Here we go. We've got 5,408 confirmed cases, and this is confirmed by the Ghana Health Service. We have 514 recoveries and sadly 24 deaths. Well, because of COVID-19, also sexual and reproductive health services are not being patronized, not because the hospitals are shut, but for some reason, some people are simply not showing up either for immunization services, antenatal, generally sexual and reproductive health services. So we've got a family health doctor joining us. She's actually the acting director, Family Health Division of the Ghana Health Service. Dr. Isabella Sego Moses is on call this morning on the AM show. She's going to help us appreciate how widely spread this is in the entire country, but also help with your questions. If you're pregnant and you're not going for antenatal, why? If you're not sending your child for that immunization, why? What are you so afraid of? That's why you're not going to the hospitals. Dr. Isabella Sego Moses is joining us via Zoom. Let me say good morning to you, ma'am, if you can hear me.
Good morning. Yes, I can hear you.
Okay, great. Thank you for being our doctor on call this morning. So help us, first of all, appreciate what this issue is and why the Ghana Health Service is worried.
All right. So this issue is something that has been noticed in other parts of the world. Whenever there is a pandemic, it turns out that all attention is focused on curbing the pandemic, and somehow routine services tend to suffer. And that has been reported in the case of the countries that had Ebola, like Liberia and Sierra Leone and other parts, and during other pandemics as well. So unfortunately, we are observing the same trend in Ghana. We are noticing that our routine services like antenatal care and child health welfare clinics are not being patronized as much as before. And that is a source of concern for us.
In terms of the data that you have, when you visit?
Yes, in terms of the data that we have, for the first quarter, for example, we compared our figures for this year, first quarter, with figures that we were seeing in 2019 and 2018. And the number of women coming to antenatal, the number of children being brought to child welfare and postnatal clinics are all reduced for the first quarter comparing to the previous 2 years. And if I may be more specific, if we look at our immunization services, we looked at comparing this year's first quarter to last year, and we realized that the total number of children that were being immunized has fallen, such that the unvaccinated children that we recorded for the first quarter is almost 33,000. So it means that we are not reaching them. They are not coming for their immunizations. And this is very worrying because then children will be at higher risk of contracting these other vaccine-preventable diseases.
Is it because we don't have the vaccines?
No. Fortunately, we have the vaccines, we have all the logistics. It is because there's this fear and panic about accessing health services. Our clients think that if they come to the health facility or they come anywhere near health providers, then they will be exposed to contracting COVID. And so they tend to stay away. I must admit that in the beginning, some of the health workers were also apprehensive, but that situation is changing now that the protective equipment is becoming a bit more available. So these are the main reasons. People fear that they would catch the COVID when they come near us. So I have had calls from some mothers who have expressed the concern that it's time for their children to be immunized, or they have to go to antenatal, but they are scared, so they are not going.
And this 33,000 unvaccinated, because we know that the vaccinations are also time bound. So if you have to go for 6 weeks and you miss it, it's got implications.
Yes, it's got implications, but it can be remedied within some few weeks. If you still attend and you are given the next dose, it will still work. So that is what we are focusing on now, trying to heighten awareness among our clients to access these services, to tell them that it is safe to come. We are doing all we can to protect them. And the children still need to be protected against measles, against polio, against hepatitis B, and all the 13 conditions that we immunize them against. For the antenatal women too, they still need to come to have their blood medicines, to have their blood pressure checked, to have their anti-malarials. This will ensure that their pregnancies are safe and the deliveries are also safe.
And I also wanted to ask, could it be that maybe some parents have been to these facilities and because of what they've witnessed, they haven't shown up the next time?
I won't rule out that possibility. And that is why, in trying to remedy the situation, we've done some housekeeping. We have talked to our health workers and we are making provision. So a directive has gone out from the Ghana Health Service Director General. We provided a set of guidelines stating that every vaccination or antenatal clinic should observe all the recommendations for preventing infections. So they are all providing hand washing facilities for the clients. They are all screening the clients before they are admitted into the clinic. So if anyone is found to be a suspected case of COVID, then they are not allowed to mix with everybody else. They are straight away handed over to the team that will now do the necessary testing and so on. And we are also ensuring that our health workers are also properly garbed. They have their mask on, and the clients also have their masks on, and the health workers have gloves on and change them or wash their hands frequently.
Let's talk about family planning. And if the picture you paint for the immunization is same, then we should be worried that unintended pregnancies may spike.
Unfortunately, the picture is the same. And that exactly is our worry, what you stated, especially when couples are spending more time at home now. We are worried that unintended pregnancies may arise, and with that also abortions, illegal abortions and unsafe abortions. So our messaging to health workers and the strategies that we've put in place also cover family planning.
Is the same reasons that you're picking up from the ground? And if you've got data to help us appreciate how badly the situation is in terms of the comparison from the previous year and this year, the first quarter at least?
Okay, so let me do antenatal registrants.
Okay.
In 2018, we registered 2,000, I'll round the figures up for ease of understanding. So in 2018, we registered close to 242,000 women at the antenatal clinic. In 2019, we registered almost the same. But in 2020, first quarter, we only registered 2,336,000. So that's for antenatal clinic. And then when we come to, just a minute, child welfare clinics, in 2018, we registered about 400 and, we registered about 4 million children at the child welfare clinics. 2019, a little more than that, about 4.1 million. But 2020, it's come down to 39, 3 million.
Okay,
so
and this is as at what time? This is as at what time this year?
This is first quarter, as at March ending. Yes.
Okay.
So that is the situation. And we are seeing that in almost all the regions, the drops in the registration.
Okay. Which of the regions would you say will be recording the highest figures?
The highest, like those that are having most people attending.
The lowest patronage, exactly.
Oh, lowest patronage. I don't have that readily at hand, but we do know that Greater Accra, I talked about unvaccinated children earlier, where I said 33,000 had been left unvaccinated. Greater Accra alone had 12,000 children left unvaccinated. And I am not surprised, because it is Greater Accra and Ashanti that we had the lockdown. So the lockdown also had played a role. I mean, apart from all the fear, the lockdown also rendered clients, they didn't know whether they could go out safely within that period. So that also made the situation worse.
Well, we will talk about how do we change this? How do we change people's minds? What do we tell them so they are not afraid, and then they can go out there and visit the health centers? But let me invite our viewers to join us with their questions. If you're pregnant and you're not visiting the hospital, why not? What's your fear, really? If you're not sending your child out there, why not? Give us a call on 0302-211-69102. 0302-211-69102. Alternatively, you can also send us some WhatsApp messages. My guest is Dr. Isabella Sego-Moses. She's Acting Director, Family Health Division, Ghana Health Service. She's going to take your questions, and hopefully, we can make it a lot more easier. We can put some kind of confidence in you so that you can wake up and visit the health facilities. Dr. Sego-Moses, initially we said if you're feeling sick, stay at home, call the emergency numbers. Even though we're no longer under lockdown, we still can go out there and still do our business, except that you have to follow the protocols. You must wear your face mask, you must social distance. But we are also saying, if you can, stay at home. That stay at home message is still very much on. Could it be the reason people are not confident enough to step out?
It's a possibility. So even when we said stay at home, we did say that unless you have to go for essential, you have to go out for some essential reason. And perhaps we should make it clear that if you are going to access health services, preventive health services, antenatal, postnatal, child welfare, these are essential reasons for going out. So we shouldn't stay away, because staying away from these clinics is rather put us into more danger in trying to prevent ourselves or protect ourselves from COVID infection. We might end up with other health conditions that we could have easily avoided.
Let's go onto the phone lines. Kukwa is in Tema. She's joined us. Good morning, Kukwa.
Good morning, Amazing.
I hope you're well.
I'm great.
Okay. Great, we thank God. Is it a question or a comment?
A comment and a question, too.
Okay. All right, please go ahead.
Well, my comment is I have a 9-month baby.
Okay, Kukwa.
Yeah, I have a 9-month-old baby. Well, on his 8th month, I was supposed to go for weighing, but because of the lockdown and all these things, part of me was afraid, so I didn't go. But this month, he turned 9 months. We were supposed to go for our vaccination and stuff. We went there, and they told me they are not doing weighing, and the vaccine too is finished. And they took my number that they would call me. So I had a friend who's a nurse, so I called check up, and he was like, oh, yes, they have the measles, but the yellow fever, they don't have it. And she would get back to me when she hear anything. So it's not that we are not going. We are going, but yes, we are afraid at the same time. But, like I said, I went there, they said they don't have it. So me going back there, I'm a little worried, and at the same time, I need that vaccine for my baby because 9 months, I don't know if after 9 months, whether, he can still take the vaccine.
Okay, so which facility specifically, Kukwa?
I went to the Sakumono.
Okay.
Sakumono, yes.
So they haven't called you back?
No, please.
Okay. Let's put that question to Doc. Doc, I'm sure you had Kukwa.
Yes, I did.
Okay.
This is unfortunate. As I said in the beginning, we were all, the health workers as well, we were all caught up with COVID activities. And the shortage of the vaccine that she's talking about must be a localized one for that clinic. It's not a shortage. We don't have shortages nationwide. Even after 9 months, Kukwa, you can still take your baby. It's okay to vaccinate and it will still work. We'll check up on this facility, but you are also free to, if you know any other vaccination site close to you, you can go and your child will be vaccinated, even if that's not your regular point of attendance. Especially because this week is our Child Health Promotion Week, and we are upping our activities for immunization, vitamin A, and all the child welfare services. So it's very likely that even in Sakumono, where they said they didn't have the vaccine before, it's more likely they will have it.
Okay, but should she be worried considering...
After this program, I'm going to call and try to address that.
Okay, great. But should she be worried because this is the mother who was due to get the vaccination and it didn't happen? Of course, she'll have a few things on her mind.
No, don't be worried. Just try and get it as soon as possible. There is some leeway, even if you miss your scheduled date.
Okay.
It's still okay to go.
All right. Let's talk to Al Hassan. Al Hassan is in Teshi. Good morning to you, sir. Thank you for calling.
Good morning.
Yes, sir. Let's hear you.
Please, my question is about this weighing. Because my wife went to a Lakeman Hospital, Fibro, and she was told that once it's not coming for injection, they are not going to treat her. She has to go back. They are treating those who are coming for injection. So I wanted to find out whether it's true or this.
Okay, so Al Hassan, how long ago was this?
Last month or so.
Last month. Okay, so
Yes.
so the child was just going for the regular weighing, not to take injection.
Yeah.
Okay, all right. We'll put that question to Doc. She'll address it. Let's talk to Majid. Majid is in Tamale. Good morning, Majid.
Yeah, good morning.
Yes, Majid, thanks for calling. Let's hear you.
Yeah, having my wife, she's having 6 months pregnant, and she's going for Tamale TPH for regular
antenatal.
So when this COVID-19 came, they told them that they shouldn't come again. They closed it. So as of now, from March up to date, they haven't gone to antenated.
So even in the month of May,
they are not doing it.
Even in the month of May, they said they are not providing such services?
Yeah.
Okay,
yeah.
and this is Tamale Teaching Hospital.
Yeah.
Okay.
Yeah.
All right. All right. So, well, thank you for telling us about it. We'll let Dr. Sego address that. Solomon is in Asofa. Hello, Solomon.
Yeah. Hello.
Is it Asofa or Asofa?
ASOFAN.
Oh, okay. All right. Sure. Let's hear you. Hello, Solomon.
Yeah, it's Asofa. ASOFAN.
Okay, I get it. You're on air, so let's hear your question or your comments.
Okay, about what the woman was saying. Yeah, the same issue the woman was saying, complaining from Tema.
When you say the same issue, you went to a facility and they say they didn't have the vaccines?
Yes, please. We went to Kolebu.
How long ago was this?
Don't have the yellow fever.
Yellow fever. Okay. How long ago was this?
Well, it was right after the lockdown.
Okay, so this will be in April.
The Monday after the lockdown.
The Monday after, and you haven't gone back since.
No.
Okay, so the child.
We're giving the measles, but not the yellow fever.
So the child hasn't still taken the fever vaccine.
Yes. Yes.
Okay. All right. Let's talk to Yusuf from Cape Coast, and I'll let Dr. Sego address the issues that have come up. Yusuf, good morning.
Yeah, good morning.
Good morning, Yusuf. Thank you for calling. Let's hear you.
Yeah, okay. Please, what I want to find out is children of, let's say, about 2 weeks old, are they supposed to take any vaccine? Because my wife went to the hospital when my child is 2 weeks old, and she was told that if the child is okay, she should go back home.
Okay, but the child got the initial, you know, when the baby is fresh, you also receive something.
Okay, when the baby is fresh, I know the baby receives something, but then I don't know if the baby actually got some vaccines when he was fresh. But then I'm sure that thing will be done. But later on, after 2 weeks.
Okay, so which hospital specifically are we talking about, Yusuf? Hello, Yusuf, I'm losing you.
Yeah, I said Cape Coast Teaching Hospital.
Cape Coast Teaching Hospital. And how long ago?
That was last week.
Last week. All right. Doc?
Yes. Thank you. I am very happy that we are getting, this feedback from the ground. So there was one question about weighing at LECMA and the mother being told to come back when the child is due for vaccination. One of the strategies that we have talked about to reduce contact is to try and focus on the very essential visits. So if the child goes when they are due for an immunization, then the necessary things would be done. And for now, it's not really necessary to go for all the, series of visits. We want to maximize the visits so that we reduce the time that they are in the hospital. Then Majid about the 6 month.
This is the Tamale. This is
the woman
6 month pregnancy.
His wife who is 6 months pregnant and went to Tamale Teaching Hospital. I think that a number of these things occurred at the beginning, especially during the lockdown, when we ourselves were overwhelmed and some of the staff were drawn into the COVID prevention activities. But that has been rectified. And we are sending out messages. We've been sending out messages to the communities that they should come. So please let the woman go back for her antenatal clinic. And then Solomon talked about also yellow fever, similar to the Sakumono situation. I would advise again that we go back to the health facility. But from here, I'm also going to find out about the yellow fever situation. But as I said earlier, I'm not aware of any shortages in vaccine. So it may be a local situation that should have been rectified by now. For Yusuf, a child who is 2 weeks, as was rightly mentioned, at birth, the children are given BCG immunization against TB, and they are also given their first dose of polio immunization. So it's possible that the child has had these at birth, and the evidence will be in their child health, maternal and child health record book. So Yusuf, you can check that. And that may be why they said they don't need any vaccine. But if they've not been given at birth, then they can go back and have it given now.
But
so after the vaccination at birth, we don't give them any other vaccine till they are 6 weeks. So the 2 weeks check is just for postnatal to see if the mother and baby are well.
Okay. Doc, on Majid's issue, because he did say that they're not providing antenatal services, is this something that you're aware of, or you think it was only because of the lockdown?
Yeah, I think probably it was the lockdown and some other issue local at Tamale. We are providing antenatal care for pregnant women. It's very, very important.
But if he goes and the situation is still the same, what then can he do?
As I said, after this program, I'm taking note of all the comments that are coming.
Okay.
And I'm going to touch base with the various regions and facilities.
Okay. All right. You can give us, if you have concerns, if you've got a question, kindly call us 030221169102. I have some messages I'll be sharing. By Yusuf, you called from Cape Coast. Please take the weigh-in card and check if they have records of any vaccinations they may have given you when the child was born. Check, and then you can give us a call back before we wrap up. Even if we've wrapped up, kindly call back and give us that feedback. It's really important. So check the weighing card and let us know. But I'm impressed because we've gotten a lot of calls from men. It means that you're involved in the process, which is very impressive. Richard is from Choco. Good morning, Richard.
Good morning, Madam, and how are you doing?
I am very well, thank you. Thanks for asking.
Yes,
Yes, Richard, you're on air.
Yes, from doctor's submission, I realized that they had the information from the post-pandemic. They had so far information on what the occurrences has been like. I want to find out from her, based on her submission, she has the data of how the trend is like in different countries, even with Ebola from Liberia and all those places. And I want to find out from her, as she has those data, why has she and her colleagues and her department sat down the moment we had a lockdown, put structures in place. From the people, those people that have called so far, they have challenges accessing the healthcare, right? I believe now she's going to get those people in the what she doesn't know about the local shortage or something like those things. I believe in her department, they have to put all those structures in place before even the lockdown.
Okay.
And then from the guy that called from Tamale, the wife went there and they have to return the wife back to the house. All those things will deter even the patients going to the healthcare facility to access it.
All right. Well, thank you for the feedback, the observation. Well noted. We'll get Dr. Sego to comment on that. Dennis is in Dansuman. Good morning, Dennis.
Good morning, Mama. How are you?
Very well, thank you. How are you?
I'm blessed. I'm
great.
So,
thank God. Let's hear you.
Okay, Mama, I have a question similar to one of the earlier callers. And this time around, my child is close to 3 months and now he's 6 months. You know, we've been attending the antenatal, should I say antenatal or the, how do you call it? Is it antenatal?
No, I think antenatal is when you're pregnant, isn't it? Okay, so this is the weigh-in. This is the...
Okay, yeah. So my wife has been attending the weigh-in before the lockdown, and then she decided to pause due to this COVID-19 issue. She's not been going for some time now, and the child is due for the 6-month immunization. But with the current number that we are experiencing, I want to find out, is it advisable that she go, because she's been attending it at La Paz, or she can get to the nearest hospital or healthcare facility so that she'll be immunized? That is what I want to find out.
Okay, so where do you live?
I live at Dansoman.
So that's where your wife is as well?
Yes.
Okay. I think the advisable thing is to find a facility in Dansoman to attend to, but I am not the expert, so we'll let Dr. Sego comment on that. Okay?
Okay.
All right.
Question is, I want to find out that if for any other reason she decided not to go for the immunization, would there be any effect on the child?
Okay. This is 6 months, you said?
Yes.
Okay. All right, sure.
Okay,
thank you. Yusuf from Cape Coast, you have the feedback. You've joined us again. Yes, Yusuf? Okay, let's hear you. So you have the weigh-in card?
Yeah, at the moment I'm not in the house, so I called the mother.
Okay.
To find out, and she told me at first the child was given injection.
Okay.
So it confirmed what the doctor said.
Okay. All right.
All right.
Okay, then.
Thank you very much.
Well, you're welcome. I am glad that we've been helpful to you. Yusuf there with that feedback. Doc, there was a comment, observation, feedback from Richard from Choco, and then Dennis in Dansoman with that concern. If a child is 6 months, can they miss the vaccination?
My advice to our caller from Dansoman, please, as much as possible, try not to miss the vaccination. Because every time they attend, we have specific vaccines that they are given. And they are given vaccinations against 13 different conditions. So if you miss one and you don't go at all, you don't know when that the child will be exposed to that particular condition. And if they are not covered at that time, then they are likely to succumb to it. However, if you have missed and you know, it's not too late. As was said, you can attend the nearest, your wife can attend the nearest facility in Dansoman, and they just take the card, they would look at the records and then continue from where they left off and give them the ones that they have missed as well. There was a comment from Richard. Richard, let me assure you that we are not just now waking up and saying that this is the situation. We have been studying what is happening on the ground. We have put down together some guidelines. We have engaged all the regions, and the regions are also engaging the downstream districts and health facilities. It is true that in the initial stages, like the rest of the country, we were all overwhelmed, and every concern was about stopping the COVID. So some of the vaccination staff had to assist with contact tracing and stuff like that because they know the communities well. Now we are back. We have put in measures, and we are doing massive health promotion. We are also currently this week marking Child Health Promotion Week. We are sending out messages all over to try and pick up the pieces. So maybe we could have done it earlier, but let me assure you that we have not just been resting on our oars. We've been studying the situation and putting things in place.
All right. Here's a message from Ben. Ben is in Brekum. Ben says, I took my son for weighing and I was turned back with the reason that the child has to be undressed, which wasn't safe because of COVID-19. I was asked to come back when the COVID is reduced, gone down. We'll get Doc to address that. But Obed is at 37 and he's joining us via phone. Obed, good morning. Thank you for calling.
Good morning. Thank you once again.
All right, great. Let's hear you.
Yeah, mine was not really after birth, but during like antenatal. Yeah, I and my wife actually attend our antenatal at Tema General. And one thing I want to say is we have to thank the Tema General Hospital because their midwife are still taking care of us even whilst we are not visiting the premises because of COVID. One of our midwife, Man Lizzie, I don't know the full name, Man Lizzie, actually responds to our call day in, day out to check on how my wife is faring and how best we could receive treatment.
Okay.
So,
are there particular names that you have?
Okay, unfortunately, I don't have the name of
her,
but right. I know Man Lizzie, I think room 5 or room 6 at Tema General Hospital.
Okay, all right. Well, thank you for appreciating the services that you've rendered. Obed from 37. Let's talk to Joseph. Joseph is in Seshi, Genase. Joseph, you're on air. Good morning.
Good morning.
Yes, sir. Let's hear you.
Okay, my issue is I went to Seshi Regional Hospital yesterday.
Okay.
And a friend of mine was feeling very sick and hot, but they just gave him malaria tablets. Actually, there was no testing whatsoever, and they said I should take her back home. So I was a little bit concerned. So she was very, 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 very hot in the morning, and so I was wondering whether, I don't know the process. I don't know what actually they do when it comes to COVID-19. Whether when you are feeling very hot, you don't need any testing or something.
So was this a child or this is an adult?
It's an adult.
Okay, and you said that the person was feeling hot.
Very, very hot.
And all they did was?
All they did was they asked her how she was feeling, and the doctor prescribed malaria and prescribed malaria drugs for her.
Okay, so no laboratory tests?
No laboratory tests.
But are you familiar with the symptoms of COVID? Are you familiar with the symptoms of COVID?
Yeah, I'm very familiar with the symptoms of COVID.
Okay, did your friend experience anything apart from you said the temperature? Apart from that, was there anything close to the symptoms that you've had?
Yeah, it's only the temperature.
Okay. Well, is there a second facility you can visit?
Yeah, there's a second facility.
Why don't you try that?
Okay, and there's one thing too I wanted. It's not related to the healthcare services, but I just wanted to draw attention.
Okay.
Concerning the public gambling places. It's like during this COVID-19 pandemic, nothing has been addressed concerning those places, and people are trooping in there. I don't know whether people follow it up.
So this is the betting outlets.
Pardon me?
The betting, you mean?
Yeah, okay. The betting outlets.
Okay.
They are still in operation, and a lot of people are there 24/7.
Okay.
And so I'm wondering,
is there a specific community where you've witnessed this?
In fact, I've been in Kumasi.
Okay.
It's on. I've been in Sefi here. It's still on.
Oh, okay. That was really important message that you were passing on, but I guess that we get it. Thank you. We'll try and do the follow-ups with our colleagues in the region. Let's take some Facebook messages. We'll let Doc address the concerns that have come through via phone. But here we go with the comments on Facebook as well on the same subject. Question is, are you afraid to seek medical care at the hospital during the COVID-19 era? Share your thoughts with us here and also via WhatsApp number, and here are the responses. Stevens says, in Ho, there's no fear. Face masks have been sold exactly at the hospital's entry point. Without it, you will not be allowed to enter. Hand washing facilities have also been provided at vantage points in the hospital. All right, that's very good news, Stevens. Thank you for sharing the whole experience with us. Ken says, yes, I'm afraid because slightly rise in temperature nowadays mean you have COVID-19. What about first when COVID-19 was not reported? Then we have high temperature, body temperature. All right, Ken, on the general COVID situation and how we're all feeling when you're down with any tiny thing. Prince says, yes, last I went to New Regional Hospital with my patients and I saw the health workers, they're treating patients at the emergency ward without hand gloves. This means that the likelihood of them contracting the virus is high, and transmissions to other innocent patients also very high. So sharing an observation with us, Prince Prelix Holiness. Any other more comments? So here's Churches. Okay, having flu for the past 2 days. Anytime I'm sick, is this kind of flu? But now, dear, I'm afraid to attend hospital with this. Okay, so Churches having some flu and not wanting to go to the hospital because of fear. Angel Michael says, yes, because now the moment you get to the hospital, if your body temperature rises, PET automatically will be attributed to COVID-19. So due to some of these things, some of us do not trust some health workers. All right, Angel Michael there. Whilst we wait for more comments, all right, this one's from Empress Mawenya. Empress says, I needed to go for a routine checkup at Rich Hospital on March 22nd. Fear of catching the virus there stopped me from going. So you haven't been to the hospital to check. Professor Einstein Senior says, on 12th of April, I once visited a hospital, but the way the doctor looked at me, my face after checking my temperature, I got a little scared. So okay, so you took some paracetamol before going there so that your temperature will not increase again. All right. Ajua Ohenewa says, yes, afraid of contracting due to touching shelves, sharing seats with others, and many more. Had to bath 1 full bottle of sanitizer the last time I visited. That's scary, Ajua. Emmanuel says, I'm much afraid because I lost trust in human beings. You might never know the agenda behind COVID-19. All right, Emmanuel there. Okay, John says, I can't even go to the hospital because I'm scared of being isolated. The stigma alone will kill me early. John, you didn't indicate what is going on with you. I guess from what you have shared, you're experiencing something. You're definitely feeling something, but you simply don't want to show up in the facility. Bayer Jeremiah says, more than the word afraid, the increasing rate of the virus is scary and worrying. I witnessed some people's cough, and I swear never to step at the hospital in this COVID-19 era. The dangerous aspect of it is that people don't take precautionary measures seriously, even at the health facilities. All right, so lots of feedback on why people are afraid to go out there to the hospital. This one says, at birth, my boy was given BCG, but there is no scaring on the... Can I go for a second vaccination? Mary from Wa, I'm not sure I quite understand some aspects of your message, but you're asking, I guess, the latter parts, if you can go for a second vaccination. So that's a what situation. Doc, let me allow you to comment on some of the issues that have come up with the telephone calls and also with the Facebook messages.
Yes. All right. So I think the first caller in this section talked about the child being taken to child welfare clinic and being told to go back because they have to undress and so on. I think it's a similar situation to what we addressed earlier, that if the child is just going for weighing, they might probably say, come back when they need vaccination, so that we give that essential service. They wanted the weighing to wait. We had Obed being happy with what he experienced at Tema General. And I'm happy to hear that, because one of the measures that we have recommended to our staff is to share their contact numbers with their clients for antenatal and child welfare clinics, so that they can reach them at any time if they have questions. So I'm happy to hear that Tema General is doing that. And I know that other facilities are doing the same. I think the rest of the comments were mainly about the fear in everybody to attend the hospital, to attend to Doc, the clinic for any reason.
Yeah, Doc, can I ask you to hold on with the comments on that, because I want it to be the last thing that we address. So let me take some messages on the WhatsApp. Okay, so this one says, are you aware that hospitals are attending to only 45 patients in 24 hours? Gas South Hospital. Morning doctor attend to 15 patients. Same applied to the afternoon and evening doctors. This is Eddie in Oglogo. My child temperature as at the time I reported that the hospital was 39 degrees. They turned me back with information that the morning doctor had attended to 15 patients. Doc, are you aware of this situation? And he cites Gas South Hospital.
No, I am not aware. We have not given a limit, of patients to be seen a day. So if this is happening, it shouldn't be happening, and we will follow up on that.
Okay. This is Mavi from Takwa says, Wayne, it's full. Oh, so the full name is Child Welfare Clinic. All right, I guess this is a nurse telling me about it because we're struggling. We know antenatal, but the weigh-in, we just say weigh-in. So Child Welfare Clinic, thank you very much.
Clinic, yes. Or CWC.
Yes, absolutely, thank you. This one says, my son was 5 years last year. However, his last vitamin A vaccine were not given, just that we came late. Nicholas in Ho. Vitamin A, doc, should not be so worrying if you miss it.
Vitamin A is also important, especially because vitamin A boosts immunity. Vitamin A boosts immunity, and this is the time when we need our immunity to be up there. So children start being given vitamin A from 6 months, and they are given every 6 months till they are 5. So, but it's okay. If he's now more than 5 years old, we should look at the diet and make sure that he's having the fruits and vegetables, and then he will have his vitamin A and other vitamin sources from his food.
There's a technical question, I guess only you could understand. Says, what's the doctor's advice to all G6DP food defects in this COVID-19 crisis? Has it got to do with children?
Yes, G6PD is one of the conditions of the blood. It's an enzyme defect. Some have a full defect, some have a partial defect. And so when you have it, you cannot take certain medicines and even some foods. And once it's detected, the parents are given the full list of drugs that should be avoided. I am not aware of anything specific with COVID, maybe the drugs that are being used, but the general advice to patients who are G6PD deficient is that anytime they go to the hospital, that should be one of the first things they tell the doctor, that my child or I myself, I have G6PD defect, and then the necessary precautions will be taken, because some medicines cannot be tolerated by such patients.
Okay. Somebody says a friend went to LECMA for review and she was charged 5 Ghana cedis for COVID fund before she was attended to. You're asking if this is legal. Well, Doc will tell us whether or not it is. And a lot of the messages that we're receiving has also got to do with issues that we've heard already, but generally the fear, people not wanting to show up. Maybe you can comment on the LECMA issue, and then I'll ask you the last question so we can address all the others that have come up.
The LECMA charging COVID 5 cedis for COVID fund. This is also something new I'm hearing.
Okay.
I'm not aware that we have given such a directive. Yes.
All right, Doc. So the point is we want to boost confidence so people can take their children or people can themselves visit the facilities. What's the plan? What are the nurses? Are the nurses wearing gloves? Are they wearing nose mask? What should be the appearance when I go for my antenatal? What should the care be? What's the plan?
Okay, so when you go to the antenatal, what we are doing now is we provide hand washing facilities for all the staff and also for all the clients. So once you get there, you wash your hand, then you are screened the way we will screen any other patient to see whether you are a probable case of COVID. And if the screening shows that maybe you're a suspected case, then you would be directed to be tested. Also, we are making sure that all our health providers have the protective gear. Depending on where you appear, either the clinic or in the ward, the protective gear may vary, but minimum is the face mask. And in between attending to clients, they will wash their hands or sanitize so that they don't pass on to anybody. If they wear gloves, then they will change the gloves between patients. We are also making sure that all our clients, all patients, also have the face mask on before they come in.
Okay.
And yes.
If I'm taking my child for weighing, should the child be wearing mask as well?
Yes, the children also. So we should get smaller size ones.
Even the babies?
The babies, no. Beyond 2 years, yes, as much as possible. We try and make sure that they are also, because we want to protect them and protect everybody else who is coming to the clinic.
Okay.
And like someone said, I think from home, many of the health facilities have the masks available for sale if you attend. So let's make sure that we are prepared from home before we go.
Okay.
We are also trying to reduce the crowds. So sometimes, in the past, we always say we have weighing sessions on a particular day of the week or a particular day of the month in the community. Now we are trying to hold the clinics more frequently so that we don't get large crowds coming in at a time. So we are doing all we can to reduce infection.
Okay.
If you are coming for routine services, you shouldn't go back, with COVID.
All right.
So we are doing our best to minimize the infection.
Okay.
Exposure.
Doc, we've taken a bit of your morning. We thank you. I really appreciate that you spent this much time with us, taking all the questions and addressing them. Thank you very much. We wish you well.
You're most welcome.
And that's Acting Director, Family Health, Ghana Health Service, Dr. Isabella Sego Moses there. Well, just to remind you, it's a Thursday. On Tuesdays and Thursdays, there's a briefing session on Ghana's COVID-19 situation. So there's another one. The advertised time is 9 a.m. So when it gets underway, we'll take you to the Ministry of Information. And today, the issues they've tabled: further clarification on hospitality sector openings, update on government engagement with stakeholders on potential post-restriction measures, and community spread advisory. So coming up is a briefing on Ghana's COVID-19 situation. Still ahead, we talk about hydration, nutrition and hydration. Remember, around this era, we're all told to keep hydrating ourselves. But apart from the water that we know you have to constantly take, what other mixtures can you make? We've got our dietitians, Nana Ejay. She's going to be sharing her special recipes with us, something that you can try at home. So you definitely have to stay with us. You're watching The AM Show.